Welcome to Building Resilience, Disaster Support for Vulnerable Populations. Before we do anything else, we have a question for each of you that we will ask you to type into the chat. So, what has made you resilient to a disaster in the past? And we're talking every audience member here. If you could answer that question, what's made it so you were prepared or could handle it during the event or bounce back after? Please keep your answers coming in during a short introduction. And again, the question is, what has made you resilient to a disaster in the past? Great. My name is Carrie Winninger with Sonoma State University's Center for Environmental Inquiry, and I will be your technical support today. So if at any time you have a problem, you can send me a private message in the chat. The agenda for today includes a short introduction by the Center for Environmental Inquiry team, followed by a panel discussion. Next, we'll get input from audience members who would like to share, and then we'll have quick feedback from all of you via the chat before returning to the panel for final thoughts. A few technical guidelines for this workshop are, this is a Zoom meeting, not a webinar, and as such, you all have control over your own video and audio. So please keep yourself muted, except during the discussion, where we highly encourage you to speak out. Other than that, you can use the chat as much as you'd like for questions, comments, technical help, etc. This event is being recorded, so please take a moment to type your full name and affiliation into the chat right now as our sign-in sheet for the day. I would really appreciate that because sometimes Zoom names don't match who you really are. All right. This is the third lunch in North Bay Forward's Building Resilience series, a year-long conversation focused on ways we can work together to build resilience to climate change in our region. For those of you who may be new, North Bay Forward discussions are focused on ways to increase collaborations that enhance sustainability and resilience. We invite speakers to highlight best practices in the region, then discuss ways to best support or expand on these efforts. If you'd like to be involved in planning these, please send an email our way. We would like to thank the Regional Resilience Working Group of the SSU President Sustainability Advisory Group for helping to plan and host this event, many of whom are here today. And now I would like to turn it over to Claudia Luke. Dr. Luke is Director of the Center for Environmental Inquiry and Director of Sustainable Programs at SSU. She's going to give us a little background on disaster preparedness of vulnerable populations, introduce our speakers, and moderate the discussion.
Great, thanks so much and welcome everyone. I'm going to start with just a few minutes before we get to our speakers, our panelists. Just spend a few minutes talking a little bit about why we're all here, what is the Regional Resilience Series. Climate, it's really all about climate. Climate projections, of course, everybody is aware, show increased floods, fire, drought, heat waves, and those are unfortunately all becoming a reality of our lived experiences. So through this series, we are hosting conversations around what do we need to do to integrate this new normal into our existing planning and preparedness. So today we're talking about a key measure of resilience for any society, and that is providing disaster support for our most vulnerable populations. So the people that we consider most vulnerable are not, it's not an identity. It's something that's always in flux, right? Depending upon what your condition is. So it could be that you're a non-English speaker and you can't get the communication. It could be you are frail, elderly, or disabled, or sick. People who are unemployed or homeless. Even people who are in certain geographic locations, like they are more vulnerable to a fire or they live in a floodplain, things like that. So you can see that each of us, our vulnerability is changing. So how do we go about as a society building an effective response and recovery system for those populations, for those individuals that are the most vulnerable? We know a few things about that. We know that our systems need to be comprehensive. We know, hold on just a second. I just lost my place. Yes, okay, we know that the programs that we build need to be comprehensive. So there's all sorts of things. It depends on the individual. We know that they're going to need food. We know that they need help with shelter. Sometimes it's translation for non-English speakers. Sometimes it's transportation, or it's emergency childcare services, employment opportunities. And more recently, we're also realizing the importance of specifically addressing psychological, emotional, and behavioral health recovery needs. So in addition to those kinds of comprehensive services, there are studies that have shown that the communities that are the most resilient to disasters focus on building the social connections, individuals, families, social networks, communities. We also know that those more resilient communities build awareness of the disaster preparedness before the disaster strikes. And almost even most importantly, that in that planning process, as we engage in these discussions about what can we do to be better prepared, that we have authentic representation, that we're looking to the communities that are most impacted to help develop the solutions that are going to work, and that we are highly collaborative. So today we're talking about what are we doing in Sonoma County, and what can we do better to help our most vulnerable populations weather disasters. This series is really important to Sonoma State. SSU's Climate Action Plan will be released in April of 2022, next year. And it will include not only actions about carbon neutrality, but also what are the ways that SSU can work with other organizations in order to build resilience. So these conversations are critical to us to better understand how we can be working together to build a more resilient future. So that's the context for what we're doing. And today we have 3 organizations I'm really excited about having a conversation with. They are all at the forefront of providing comprehensive services to vulnerable individuals in our society. The first, we have Erika Klohe, who's with Providence, Sonoma County, the Community Health Investment. And they work in partnership with local organizations to promote health and community engagement. We also have COVID-19 Urgent Response and Aid, or CURA. The project director with us today is Amanda Hernández. And CURA connects Latinx, Indigenous, and low-income community members to community-based services. And thirdly, from Sonoma State, we have 2 participants who are working on the SSU Basic Needs Initiative for students. Laura Monje-Paulson, who's the Assistant Vice President for Student Affairs, and Meredith Bates, who is the Community Service and Basic Needs Coordinator. The Basic Needs Initiative is also taking a holistic look at student well-being and helps coordinate services. So you can see we have people who have a lot of perspective on the complexity of providing a comprehensive approach. So I'd like to start with this panel discussion. Just if each of our speakers from these programs could spend about 5 minutes just telling us about your mission and the ways that your organization provides disaster support for these vulnerable populations. So if we could start there. I think I'm going to start with you, Erika, because you have such a broad wealth of experience, long experience working in the county trying to coordinate services.
If I can unmute myself. Hi, everyone. So nice to see you all. I love being able to see your faces. That's helpful. So I have a unique role. I work at Providence. And so Providence has many different areas of service. So we have urgent care, we have several hospitals. Our department is our community health investment, and we are connected to 3 of our hospitals. So that's Memorial, Petaluma Valley, and Healdsburg. And the work that all of us do is to really support our community. Our mission is that we are steadfast in serving our community, especially the poor and vulnerable. So we do that across our system of care. And in our department, in my role is really around access to care for those in our community that don't always have access. And so we do a lot of different things around supporting our community and helping our community to have access to care. And I'm sure as we go through the conversation, I'll be able to add more information on how that looks. And I'll drop some information in the chat. I have a background in my role at Providence. I am not doing clinical work, but I'm actually a clinician. So I also did disaster response during 2017. So I was working at one of our health centers and decided to leave my role there, and I went and worked in the field. So I actually have experience with our community in disaster response.
Great. Thank you, Erika. Amanda, I thought maybe we could spend a little time finding out more about the COVID-19 Urgent Response and Aid initiative.
Yes, of course. Excuse me. So CURA, or we usually just say it CURA because it's a long phrase to say. But really what CURA is it's a community collective of both other agencies as well as community leaders, really working towards providing a culture responsive services and with language access to our community during this COVID-19 pandemic. So what all of that really means is we're working collaboratively with multiple other organizations and with our internal team of CURA. So what that kind of looks like is we're providing emergency financial assistance to community members that are affected by COVID, whether it's a loss of income due to hours being cut, or employers not paying for people to be able to be isolated and keep the rest of the community safe. But also being able to support, there's increase of costs. We know people in the community have had increase in medical bills or had hospital stays or unfortunately deaths of family members due to COVID. So our emergency financial assistance is really there to support those who are most in need, right? If you think about it, we have a lot of, living here in Sonoma County is very expensive. But pre-COVID, we already had families who were already possibly living paycheck to paycheck, or multiple families living in a single household. So COVID-19 just increased all of those needs. And so this is really a response of how do we continue supporting the community with information, education, and also emergency financial assistance. So also part of our team, we really work towards providing education around vaccines, providing access to testing and information, as well as even information around quarantining, what that looks like, the importance of wearing a mask. So we do a lot of those education pieces in addition to our emergency financial assistance. And then part of that too is we're also working with agencies across the county so that when a committee member comes in needing assistance or having questions, we're able to help them internally with either the emergency financial assistance or any education or resources. But we also want to connect them to resources that are local to them. If it's their local family resource center, if it's ensuring they have access to food, if it's medical care, it's really people call maybe for one thing or hearing about the financial assistance, but really what it is, we end up being able to provide them a ton of other services and working collaboration with all of our different partners. So it really is a network, because this work can't be done just one agency or just one person, because it's a lot of work. So we really work very closely with so many other partners to make all of this happen. So that's just a little bit, like a little snippet of what CURA is.
Great. Thank you so much. And then Laura and Meredith, can you tell us a little bit about the Basic Needs Initiative that you've undertaken at Sonoma State?
Sure, I'll get us started and I'll pass it over to Meredith. So the Basic Needs Initiative at Sonoma State is a part of a broader initiative across the CSUs, acknowledging the basic needs that our students are presenting with today. It's evolved and changed, and there are plenty of institutions within the university that have become even more important for our students, or the number of students who are in need of mental health resources or basic financial need has really changed as our society has changed and the role of higher education has changed. And so as a public institution, that's something that the Cal State University has focused on quite a bit, saying that universities need to be better at acknowledging that in many ways our students are presenting with very basic needs that are impacting their ability to show up in the classroom and engage in their academic experience and journey in the way that many of us assume they would be, right? And so in the Division of Student Affairs, we're certainly charged with a lot of that outside of the classroom work. And it's easy to see where different pieces play a role. But the Basic Needs Initiative is our way of really conceptualizing the comprehensive needs and our approach to meeting those needs for our students. And we have an important partner in that initiative with our associated students, which is why Meredith's here with us. Today, our associated students are an auxiliary of the university and so do operate as a separate corporation. But because the folks who are running that corporation are our students, we stay very closely connected with the ways that they're engaging. So I will, before I pass it over to Meredith, share that, in the Division of Student Affairs, we continue to focus and take responsibility for our counseling and psychological services, our student health center and student health education and services, and housing is the other main component of the Basic Needs Initiative that we recognize as an important part of our role. We have housing on campus, providing housing to students, providing affordable housing and access to housing that's a key resource we have as a university to provide for our students as well as to our community, certainly during disaster, which we can talk about more, throughout the conversation. And then I'll pass it over to Meredith to talk about some of the key pieces that the Associated Students works with us on that initiative.
Thank you, Laura. Hey, everyone. So like was mentioned, I'm the Community Service and Basic Needs Coordinator in Associated Students. So again, like Laura mentioned, Associated Students is a student-led, student-run auxiliary at SSU. But the Basic Needs Initiative takes that holistic approach to how we support our students at SSU. So part of my position is the advisor to the student-run, student-led service organization called JUMP, Join Us Making Progress. So those are more of the community service opportunities that we offer students. And then the other part of my role is overseeing the Basic Needs Initiative and the different programs that we offer students. So things like the Lobos Food Pantry on campus, CalFresh Outreach, transitional housing. So those like transitional housing for like students who are in transition like off campus, so like hotel stays, or helping students get on campus housing to meet their long-term housing needs. And then also assisting students with any basic needs, grants. So if there was an emergency like a car accident, severe illness, those emergency grants are there to support our students. So that's a little bit of what I do. But the cool thing about Associated Students, again, like Laura mentioned, is it's student-run, student-led. So I'm there to, as the advisor and supervisor, but that peer-to-peer support is, I think, the coolest thing, a part of how students are supporting students and their basic needs.
That's so important. Thank you all so much. It was a great introduction. I'd like to ask just a couple questions to get us relying on your expertise and your thoughts about what Sonoma County can do to better prepare us to help vulnerable populations to recover from disasters. So this is something, disasters are becoming more frequent, and all of you have now had experience dealing with that kind of urgent and variable need that comes up. So I just wanted to ask you, here you have this ongoing work that you do. What are some of the key challenges that come up when a disaster strikes? in particular, I'm trying to figure out, is there anything that we can do to prepare for those situations? So I'll just open it up to the panel. If any of you have some thoughts about that, what are the key challenges that happen during disasters? How does life change? Every day is a disaster.
And no one wants to start. It's a big question. Well, I will say one of the things for the university, we have an emergency operations center that can be activated in disasters. And so, one of the first things is activating that center is one of our signals for moving into a different mode of communication and outreach. And a different mode of leadership, right? Who's in charge, who's making decisions, and who's expected to be at the table. I think that one of the ways that we continue to strategize around preparing for those moments is thinking about whomever is sitting at that table in the EOC, right? Who is still available and in charge of managing the day-to-day and the operations of the departments and the division that do already have those wraparound services for our students, and being able to funnel that information back to the emergency operations center, but knowing who would be, and being mindful about who would be the most appropriate folks to be delegated to those roles. So that, again, from a planning perspective, we already know who would be activated. We know who would be reporting to us, how our students are doing. And I think one of the other pieces is that we have some ongoing, you had talked about earlier, Claudia, the social networks and things like that as important. And we have a lot of ongoing student communities that are centered around advising or shared identities or shared experiences. And we really lean on the coordinators of those programs to be our eyes and ears for referrals in those moments, so that we're not checking in on 8,000 students at one time, but that some of our students who may already be in, or likely are in, some of our most vulnerable positions by way of, having access to certain programs, we kind of know and have relationships with those students in ways that we can ask genuinely and assess need, and then funnel back up that information to our EOC. So that's, I guess, maybe just to get us started, one of the key strategies that we utilize.
That's fantastic. It's such an important, interesting shift to think about, that you have to have communication structures in place, but you also have to create a new communication structure when a disaster happens. Erika, have you noticed things like that, or other things that come up during disasters?
100%. So in public health, we have all of these different people doing a lot of different work. I think it was Amanda that said, there's not enough of us, right? And so we're all doing intense work to support our community, whatever the disaster was, a flood, a fire, then a pandemic. Sonoma County has been definitely hit pretty hard in the last several years. The thing that I think has been really successful and beautiful about Sonoma County is that we actually do, as a community, build these networks. And as we have funding come in, we build out networks. So there's several different networks that kind of came out of the fires. So one of them was the Sonoma Community Resiliency Collaborative, and so that's all around mind-body medicine. There's several people. I think there was like at least 200 people that were trained in this modality to help support our community. And that hub is still continuing to this day from 2017. I'll drop that in the link in the chat. We also now have Sonoma Connect, Sonoma Unidos, which is also another network really focused on education and youth and ACEs and trauma-informed care and building out community networks. So the more that we are interconnected, the more we can spread information. And so when a disaster happens, we have the disaster response, the EOC. So all of us on the ground floor or in administrative roles where we're trying to funnel information up, like this is going sideways. We have to funnel the information up, and then all of us have to adjust. but we're literally the network for our community. So all of us at the table here at this meeting are a part of keeping our community safe, spreading the information as quickly as it comes out, getting people the resources, if it's food, if it's, I need a hotel stay. So I think it just really takes that community collective partnership. And in, 2017, we saw that in truckloads, like the love was definitely thicker than the smoke. And so I think that shows our resiliency as a community. I'll drop a couple of things in the chat too.
Great. Makes me think, Amanda, your organization probably, well, it was formed around a disaster. And I'm wondering, are there certain aspects of the COVID disaster that you've noticed just within the trajectory of your career that are unique because it's an ongoing urgent need? Are there aspects that we could learn from in setting up something like CURA?
Yeah, and thinking about this question a little bit, some of the things that initially came up are things that were already happening pre-emergency, right? So, and then just because of the emergency, it just increased the need for it. So looking at equity, right, is what we're providing or what's being provided in the community equitable across different communities? And also, is the information prior to emergency, but especially in an emergency, is it accessible, right? Is the information being translated into other languages? And is it being provided in those communities or the ways that those communities receive information? So it's been one of the really big things, especially even more in an emergency, is how do we get this information out to the communities who need it? And also making sure that we've built relationships with those communities, right? That we're like, was talked about before, is like that relationship building or those building of networks is really important. It's also really important in building that as organizations, right? We just don't want to come and say, hey, we're here, we're doing this. It's like, no, tell us what's worked with your community. Tell us what your community responds to and how we can support in that. So for example, just within Gura, everybody on our team speaks Spanish. We hold our meetings with partners bilingual with interpretation. We hold our team meetings in Spanish. So really making sure that, one, internally, if we have monolingual Spanish speakers in our team, that we're making that connection, but also doing the same for our community partners and not excluding anyone because of language. But that also sometimes we know there's more work that needs to be done, right? Because Spanish isn't the only language that's spoken here in Sonoma County. So how do we build those relationships to also provide access to other communities or those indigenous communities that there's so many different languages? How do we still provide access of all the information that's going on? And especially during disasters, right? Is how do we communicate it in the appropriate language, but also what is our mode of communication, right? A lot of the times word of mouth for these kinds of things is the best way to get information out versus doing something on social media. Yeah, that might work for a certain population or a certain group, but we have to think outside the box of what are all of the different ways that we can get information out.
Yeah, that's so important. I had a question here too. I wanted to follow up on. Maybe Amanda and Meredith could take a stab at this. But so is there anything we need to look at with regards like language, but are there other things that are unique challenges for some of the vulnerable populations? So, each group has a different issue, but what are the kinds of things that happen? What are the kinds of challenges that we face when we start trying to provide support services across cultures? And I mean that as in a very broad sense, cultures, lived experience cultures, identity cultures, all of that. Are there things that we can do? What are our challenges and what might we be able to do to address those? So I'll start with you, Amanda, and then we'll go to Meredith.
Yeah, I think one of the biggest things, and this goes to being people in general, is building that trust, right? Building that trust, that in having built those relationships and that trust prior to an emergency or prior to disaster, so that when that happens, hopefully we don't have any more, but when that happens, we're able to, instead of being like, oh, here, let me give you all information here. How do we work together? It's like, no, we've already had that established relationship that we've built over time, so that when a disaster happens, it's a natural fit of like, hey, I know I can help you with this. We know the right people to connect back and forth with, versus kind of, you know, so in emergency, everything gets a little crazy. So instead of making this huge mess, how do we already from the beginning know, like, okay, these are people we need to start building those relationships with, and that relationship with, and it's an ongoing process, right? And how do we continue to build and work together so that when really great opportunities come up, we can collaborate, but then also when there's these disasters, we also know how to jump in and collaborate together. So I think that's a really big thing.
Yeah, that is so important, because the differences you need to establish, you need to understand them, not within a disaster type scenario. So SSU is a Hispanic serving institution, and we have many different student groups on campus, students from many different backgrounds, identifying in different ways. Meredith, has that come up in your work? I know you do a lot of one-on-one peer engagement.
Yeah, so I do a lot of one-on-one peer engagement, case management, but I think the thing for me is that communication and partnerships that we have with our campus partners. Especially, I kind of look at it as like our pantry operations. Am I talking to everyone on our campus that can relay these messages to students who, if I'm not having that one-on-one engagement with the student, are they having it with the students that they're serving in their specific office or department? I also think, access, if we're putting, if a disaster happens, again, hoping it doesn't, but if it happens and we're putting out messaging, is it getting to everyone? I have students who, if they're coming in to utilize the pantry and they don't have a phone, okay, we have like a QR code set up. Oh, scan the QR code, shop through the pantry, and then you can leave. But then we have, tablets for students who don't have that. So if a disaster happens and they're not on campus, how can we still be in contact with these students? What does access look like? And I think these are things that we're working on, and I think we've done really well, but it's nice to know what we can also do better. I myself, completed grad school just this past May, and still working with basic needs for students throughout my graduate assistantship. And then coming to Sonoma State, I'm kind of taking that, theory to practice approach. Like, what did I just learn that can really help students now in real world time, needing that support right now?
This is great, really great conversation. I wanted to make sure we had time to bring in other folks into the conversation, people who are participating. And I know at least we had registered, I'm not sure if everyone showed up, but we had County of Sonoma Safety Net Services, County of Sonoma Environmental Health and Safety registered. We have the Regional Climate Protection Authority here, Sonoma Family Meal, Latino service providers, and of course, more folks from Sonoma State University. So there's a lot of wealth and of information and experience within the folks that are here. And I hope that you might be willing to turn on your cameras and engage in a conversation. Mostly, I first just wanted to start by saying, if you are working in the area and you have comments on some of these themes that are developing, please add it either into the chat or just speak up. We want to really have a give and take here. Mostly we're trying to figure out how we can work better together to support vulnerable populations across our organizations. So does anybody from the audience want to just volunteer about what you're doing, what your role is in trying to provide services, in providing services for vulnerable populations? Any volunteers? Anyone from the county here that might be able to say a little bit about county activities?
Well, Claudia, this is Tanya from the Regional Climate Protection Authority. I can certainly add a few thoughts, and I guess I would start by saying that we, in our current role, we don't directly serve vulnerable populations, but we're working on climate plans and resilience plans for the county overall. And one of the kind of gaps or areas that we're really trying to strengthen and build our knowledge and understanding is those relationships with the vulnerable members of our community, with the organizations that serve them. So I just appreciate the opportunity to be here today and to listen, to hear what's happening and feel very inspired by the information that's been shared. So really appreciate it.
Great. Thanks,
I can
Tanya.
speak a little bit about our experience with county, if that's helpful.
Please.
So
Thanks.
across both, any natural disaster, we've had to collaborate and work with the county in order to increase access and get people to the right place and the right resource. And one of the things that happened in the pandemic was that this was new for every single one of us. And, there was a lot of fear and what do we do? So during that time, we had multiple partners contact us, and I started a meeting called the Community Transition of Care meeting, where we all met. And we talked about, how we were going to move people through the system of care, how everybody had certain policies that were changing. So we all had to communicate about how someone could get to substance use or treatment. How could someone get access to vaccination? So our mobile clinic was going at and supporting vaccination, and we were making sure they had access to testing. But one of the things that I just want to shout out to the county about is that, some people don't know that every county department has the mandate to serve. So in a disaster, we had people stepping up from departments that weren't actually part of, they didn't know how to do triage or supporting someone to access resources. And they were stepping up into these roles to help in our community to get people to the right place. They were going through training so that they could support and work with all of us partners, and really to make all of this work, because we just didn't have enough manpower during a disaster. And so I just really want to acknowledge, all our first responders and our county teams for just really stepping up and working with all of our partners to make sure that people were safe and that we could get them the right information. It really does take all of us. And so I'm just grateful for that, because that's what they do, is they show up. We all are showing up to serve. So.
And Erika, I think that's such an interesting model. I mean, that requirement, I forget what you call it, they must serve requirement, whatever that's called, is really a huge a strategy for building resilience into a system, where you've pre-identified folks that you can call on, that's sort of the backup, or people who are able to do multiple different jobs. They aren't just going to be shut within their silo. That's a really interesting model, in case there's ways that we can apply that to other situations where we can have an on-call body of people who just know they'll step up and they'll be there when the need arises.
The COAD is a community model around disaster response. So I did drop that into the chat, so anybody could be a part of the COAD. And they were also part of, there's so many of us, that are all working in different ways to make sure that we can get the information and increase access and safety during these things that I unfortunately think will continue. I mean, like you said, with climate change, I think this is something where the more prepared we are, the better. And I think we are learning as we go.
Yeah, I think we do have to, we can just be assured that this will be a new thing, a new skill set for how can we best respond to each disaster as it comes up. So, okay, so let's see, there's so many things I've been thinking about wanting to get to. I guess I would like to hear from participants and from our panelists. Do you, right now, are there barriers that you see anywhere? Certainly, like some of these gatherings, COAD and other groups, like Amanda, I know you said you were participating, collaborating with all these different organizations. Are there any barrier? So those have been like solutions to enhancing this communication coordination. Are there other things you see? I mean, do you feel like we have really the structures are in place, we just need more resources to get bigger? Or do you feel like there's different strategies that we might take or things that we could do with the resources that we have to better apply our efforts? The big questions, the big challenges in front of us. I mean, or I could ask you the question this way: is what are the challenges?
I can address that a little bit. That is a big question. I had to like
Yeah.
stomach that for a minute. I think it's for me, if we're looking at the macro system, right? It's really a alignment of not duplication of efforts. So, you know, a lot of those community groups that we're doing, we're talking about, you know, for example, a good, silly, sweet example is, you know, during the holiday season, we have many different providers that are in contact with individuals that might not have, you know, food or be able to buy presents for their children. And so all of the providers on our provider teams are sending information to one provider that is making a list that we have up on partnerships website. So anybody can access that. And it's one set list that all providers are giving the information. So that's one way for us to strategically not, you know, be duplicating effort. As far as like the larger system goes, is really looking at what funding is coming through. And so what policies are changing. There's a bunch of changes that are happening on a higher level. So there's CalAIM, which is like a system change for Medi-Cal. And how do we align the work that we're doing to the system change? And then what grants are coming through to support access to care? So Sonoma Connect is actually an ACEs grant. So that's around trauma-informed care and access to resources and making sure vulnerable populations have access to care. And so that was a grant that partners together applied for. And so if we have cross partnership and applying for grants and bringing in funding for our community, we can create a healthier network as these things roll forward. And I think that is one way for us to all collaborate and work together, is to actually strategically align with policy, grants, and make that happen together.
That's great. And Laura, do you see that, you know, up from SSU campus point of view, do you feel like there's a lot of opportunity for collaborating with existing programs out there in the community, or going after grants, or are we set up as a institution of higher education to take advantage of those things?
Yes, it's, you know, I think honestly, one of our greatest challenges is being part of a bureaucratic organization with a lot of red tape and a lot of processes, and that can make opportunities to collaborate, the timeline to collaborate, really long. So I would say that's one of our challenges, and prior to the pandemic was even more challenging. One of the advantages to our requirement to really move into these shelter-in-place modalities is that we were forced to question what was essential and what was not when it came to process. So I think we've made some progress there. That's been a relief. I think also the number of meetings that have happened around the community and being able to have stakeholders from the university participate in those meetings has not only allowed us to be better, you know, aware of decisions that may be coming, specific things that we need to navigate related to the county within the context of the guidance we're getting from the state and from the chancellor's office, but it's also allowed us more face time with those varying community partners. So I think that's been really great. It's, you know, I think one of our challenges has been figuring out who needs to be in the room at the right time. And then when all of the folks who have been in the different rooms can come together to share information. And so there have been a lot of meetings that feel like we're just reporting out, but that reporting out is actually allowing us to make better decisions, you know, kind of along the way. And so I think that commitment to being present in conversations has been really, really a big a big piece to where the COVID pandemic has layered kind of our emergency response and our relationships.
This is really interesting. I'm just curious, Amanda, do you currently have connections with Sonoma State and the Indigenous and Latinx students who have needs on campus, or does that, because it's such a transient population, is there some divide there?
I'm not aware of any relationships, but also as I mentioned, this is a new role to me. Just been in this role for a couple months. But yesterday when we were having our kind of preview conversation, that was actually something that I was thinking of how we can work with, making sure that also the students are aware of other resources that are available to them, right? Both regarding COVID testing, vaccines, and all the other things to be able to support. All the resources are already provided to them by SSU, but how do we collaborate? And also, there's never enough resources. So how do we make sure that everybody has access to them, right? But I think that's a really great opportunity.
Great, this is great. Thank you, Erika, too, for all the different resources that you're putting into the chat. That's just hugely helpful. And I think to everyone, remember, you can copy the chat as part of the Zoom if you want all of those notes. Let Carrie know if you need help figuring out how to copy the chat. Okay, so we wanted to do just a quick chat, a second chat question. What is it, based upon, this has been really great conversation. I've got a bunch of different notes. What is it, what's the most important thing that you think we should be addressing right now? Like what, if you see a challenge, one thing that you think that we could do to really move forward the disaster preparedness for our most vulnerable populations. And I think that Erika provided some really great ideas there about different non-duplicating, stop duplicating services with better coordination. I think Amanda was talking about the working on the cultural barriers and establishing connections before the disaster strikes. There were a number of other things that came up. But please, if there's something else that we haven't been talking about, what are those things? I thought we'd just make sure that we capture everyone's ideas who are in the audience to see if there's some additional themes out there that we might want to address in our last few minutes. So I'm just going to give you a minute to sort of think through that and plop something in the chat about what struck you as being really important or something you brought with you before this discussion started.
And while you're doing that, everyone, Claudia, can I mention what everyone said for the first question?
Oh, great. Yes.
So the answer that people said most, and this was not multiple choice, so you all just happened to say some similar things. 7 different people said friends and family got them through disasters in the past. And then 4 people said information and knowledge. And then 3 people said having a plan or having done drills or having had experience about it before. And then 1 person each, access to resources, sense of optimism or confidence, and having a car so that you're mobile. And I think that I'm seeing some of the same kind of stuff in the chat right now. Some of it's very logistical, cost of living in Sonoma County, right? Like having a car. Some of it is, people before data. Forms are intimidating and turn people away from resources. So, right, so it's approach. And then we also see temporary housing after disasters while housing is rebuilt or made safe.
Yeah, actually, Jordan Daniels is here and he did a project on temporary housing. And I thought, Jordan, maybe you could say just a few words about your project and how, say a few words about your project.
Yeah, absolutely. Yeah, I did I took a class earlier this year put on by the UC Naturalist program. It's called the UC Climate Stewards, and it was hosted by Pepperwood. Some of you may know in the north part of Sonoma County. Anyway, I did a capstone project on temporary housing after disasters, and with specific focus on fires, and having really watched what happened after the Tubbs fire and then the glass fire, and some of the challenges that folks were having getting back into a stable housing situation. And what I learned and what I found was that oftentimes folks who maybe are renting, and since this conversation is about vulnerable populations, I think that's generally excludes folks who own a home. But the challenge is that the rebuilding takes a while, and a community may not have enough resources to provide temporary housing after a disaster, unless they think about it ahead of time. And so that was what my capstone on this class was about, is how different communities could identify temporary housing solutions for people who are displaced, so that they don't end up having to leave the community, perhaps permanently. That was the gist of it.
It's great. Have any of our panelists dealt, I mean, I know you all have, but have you ever, in what ways have you dealt with the housing issue for our vulnerable populations? I mean, it's a huge issue, but what's your personal experience surrounding this?
I can share. I've worked at a couple of family resource centers across the county, and this has been something that's always comes up. It's always we know this is, I'm just stating things we already know, but the demand and the day-to-day that you see people coming in and saying, like, if they're losing their housing, it's usually not just one family, it's multiple families. So then it's trying to find a place for those multiple families or multiple housing locations for those families. And it gets really, really sad and depressing, because it comes to a point where you're like, I'm sorry, I can't find anything for you, or whatever I find is way, way, way outside of your budget. So it comes to a point where it's like, and when you're in FRC, it's like, I really want to help you. I want to find you the resource. I want to help you. I'll help you navigate, but there's nothing to help navigate towards. And that's one of the most frustrating parts. And you're kind of there with that family or that person. You're like, I want to be here to support you, but also there's nothing I can support you with. And it's something really difficult. And that's just being the person providing the service. I can't even imagine being that person who's in that vulnerable state. And if housing is just one of the things that they're in need of, right? It's so many different things. But yeah, it's something that I know so many of us have been advocating for and trying to think. I think someone mentioned in the chat, this is something so much bigger than just here in Sonoma County. So it can't be just one organization addressing it, right? It has to be all of us working together, and not even just all of us working together, but policymakers, right? And looking much, much larger of how we're gonna navigate this, because it's a big project to take on.
And that's such a, I think we're going to end there unless anyone has any final comments that they'd like to make.
I'll just
yeah,
make one
please.
comment, Claudia, is that Providence and many partners have been working diligently to bring in housing, to bring in affordable housing is a big deal. And so I put in the chat a few group projects that we've all been working on, and know that our organization is dedicated to increasing housing. And so we have several different ways that we have done that. And I don't want to go through that whole list, but it's a big deal to try to bring that. And there's a lot of challenges with it, but we are dedicated to work on that.
Great, thanks, Erika. And Laura, please.
And I'll add one more thing, is I think for our community for our students and our staff and our faculty and our families who are all, you know, around Sonoma County, it's understanding how long the recovery can be, the journey after disaster. And, you know, so we have students who lost their homes in the Tubbs fire who started college the next year and are continuing on that journey. And so it's, you know, there's the immediate, but there's the long term as well. And really embracing the realities of that as a community and walking with each other through those challenges, and taking the time to be aware of them and all of that, I think, is a really important part of, you know, while there's immediate needs, that we also strategize around recognizing how long that journey is to recover.
Very, very good point. I hope that this conversation, I'm going to turn over to Carrie just for some final next steps, but I just hope this conversation has generated some ideas about new ways we might be able to work with each other, but also just introducing, like we were talking about, introducing it to each other. And I hope that we'll also, a lot of the resources that Erika put forward be great for us to get connected to. Is there anything else the panelists would like to connect this group to before we leave? Any resources or next steps?
And I see Erika has put her email in the chat, which is great. And this was recorded, right? So I really do encourage everybody to share this with folks who might also want to contribute to this conversation. It's at the same webpage where you registered. And our next Building Resilience event is the second Wednesday of January at noon. So that is January 12th. And the topic is greening, heat, and urban trees. And again, all of these events do focus on vulnerable populations within that topic. We have a few panelists in mind, but if you or someone you know would like to be included in that event, please do let us know. You can learn more about the event and other public events at the Center for Environmental Inquiry, including live from the field events, which are really great if you're a professor and want to bring your classes. And you also can learn about our Osborne Naturalist program. It's now called the Naturalist Ed Series, and that takes place at Fairfield Osborne Preserve in person starting January 30th. So I just put links to all of those in the chat. If you have any comments, questions, want to get involved further, please do not hesitate to reach out, even if the thought is not fully formed. You can email me right here, winingak@sonoma.edu. Please, happy holidays, stay safe, and we will see you in January.
Thank you again, everyone. Great conversation.
Thank you.